So, today we are going to study about atherosclerosis. Introduction. What is atherosclerosis? It is a cardiovascular disease in which the plaque gradually builds up in the walls of the arteries. Now, here the plaque is made up of cholesterol and inflammatory materials. Now, how the plaque is formed? The fatty deposits which contain the clusters, they move to the walls of the arteries. The immune cells, which are the fighting intruders, are sent to collect these fatty acids and transform them into hard plaque, which causes the walls to thicken and narrow, which causes further less blood flow at a time in the artery. Atherosclerotic plaques, which can be clearly seen because they rupture the arteries. They also increase the risk of heart failure, kidney diseases, and stroke. Causes: genetics, obesity, smoking, hypertension, inactivity, coronary artery disease, heart attack. This can be a cause leading to atherosclerosis. Early signs. What are the warning signs of atherosclerosis? Leg cramps while walking, chest pain while exercise, high BP, ischemia, heart failure, myocardial infarction, dyspnea, diaphoresis, and arrhythmia. Symptoms: difficulty in speaking, temporary loss of vision of one eye, drooping muscles in the face, chest pain, pain while walking, which is known as claudication, weakness in arms and legs, and high BP leads to kidney failure. Diagnosis: tests are recommended. Blood studies, lipid profile, ECG test is done. Angiography detects the atherosclerosis, which is a confirmation test. Further, cardiac catheterization is done, in which the patient is given a sedative but remains awake. A local anesthetic is then applied and a small incision is made to insert a catheter. The catheter is then threaded through a blood vessel to the heart using the X-ray imaging. A contrast dye is then injected to visualize the blood flow and identify the blockages. If the blockages are found, stent placement is done in some cases, or further catheter is removed and the incision is closed. Next, Doppler sonography is done. It is a technique which uses high frequency sound waves to measure the blood flow in the body. It helps to assess the circulation in the arteries and the veins for diagnosing the conditions related to the blood flow, like blood clots, blocked arteries, and heart valve tissues. Muga radionuclide angiography is done. It is a nuclear imaging test which helps to detect the function of the heart ventricles, mainly the left, which pumps oxygenated blood to the body. It measures how much percentage of blood is expelled out per heartbeat while the person is at rest. Next, CT scan is done. It is a type of X-ray test to see the coronary calcification, which may suggest future heart problems. Management: lifestyle management, healthy food, daily exercise, manage stress, and avoid alcohol. Pharmacological treatment: antiplatelet drugs are given, which prevents the formation of atheroma. Aspirin, beta blockers, propranolol, sotalol, timolol. AC inhibitors are given, captopril, enalapril. Surgical treatments: angioplasty, coronary artery bypass grafting, embolectomy, in which the embolus is removed, and thrombectomy, in which the thrombus is removed.